So, hello and welcome to another episode of CGEn's podcast series, The Synapsis. Just a reminder to our listeners that the name Synapsis comes from cell biology, and it is the event where a pairing of homologous chromosomes happen and during meiosis. And this is also a time where crossing over events happen. So, the CGEn Synapsis podcast is just that. It's the coming together of like-minded individuals, exchange of ideas and knowledge, and hopefully giving rise to some new thoughts and new ideas. So today, I'm especially excited to welcome our guest, Tiffany Boughtwood, on the podcast. Tiffany, thank you for joining us today.
Naveed, thank you so much. I'm delighted to be here with you in Synapse and participating in the conversation.
Yeah, it is really exciting. I've been looking forward to the conversation since we talked last, Tiffany. So for our listeners, Tiffany is the Managing Director of Australian Genomics, an Australian government initiative supporting genomic research and its translation into clinical practice through broad engagement and a collective national approach. Tiffany, I need a lot of time for this, but I'll try and squeeze it. Tiffany has 24 years experience in molecular biology and management, leading academic and diagnostic genomic programs, collaborating internationally in genetic and genomic research, consulting in health genomic implementation. She has also served on the World Economic Forum Global Future Council for Biotechnology, and also on the WHO Collective Global Network for Rare Disease. She has been an advisor to the UAE Genomics Program and also the founding director of Childhood Dementia Initiative. And I'm sure there are other things that I missed, but these are some of the major things that I would want Tiffany to be introduced as. So Tiffany, I'm very much looking to our discussion today. And once again, thank you for being with us.
No, thank you. It's a delight. I just want to acknowledge at the start, Naveed, that I'm joining you from the lands of the Wurundjeri people of the Kulin Nation in Naarm or Melbourne, and just to pay my respects to their elders, past and present.
Thank you, Tiffany, indeed. So, as is customary for our podcast, Tiffany, and for the benefit of our listeners, why don't we start with, can you please talk a little bit about the history of Australian genomics? What is the mission and what type of projects or programs are you undertaking at the moment?
Yeah, I'd be delighted to. So Australian Genomics was originally formed under a grant from the National Health and Medical Research Council in Australia, which at the time was a very large grant, a $25 million 5-year opportunity. To really, the title of the grant was Preparing Australia for the Revolution in Genomic Medicine with $25 million and 5 years. Ambitious. However, so the way we established this academic research program was looking at the infrastructural elements of the healthcare system and thinking about how do we get the data infrastructure, the federated data assets enabled for Australia? How do we consider unifying the diagnostic and the clinical community around genomic medicine and its uptake? What is the evidence we need to capture around health economics, implementation science, and then thinking about workforce and capacity and those sorts of issues. And so they were the sort of research programs we were running, and we sort of drove real-world evidence through these programs with a series of 19 different clinical flagship projects across rare diseases and cancers, and really looking at genomics as a diagnostic intervention at this stage, because this was 2016, right? So we were thinking about genomics fundamentally in the context of diagnoses. So that original 5-year program was very successful. We've actually just published our sort of big report on that 5-year program. And I guess from that, in order to deliver that program, Australian Genomics established this national research enabling infrastructure with clinical recruitment sites in each state and territory akin to your provinces, and enabled a genomically literate workforce nationally. We had coordinators and software engineers and data managers across the nation. And so I guess the Australian government has committed and invested heavily in genomic research, and we're keen to see that national research infrastructure, rather than dismantling it at the end of our 5-year program, extend it to provide additional support to government-funded genomic research, improve its efficiency and impact. And then the second element of that is improving that challenge we all have with research translation. So we have a wonderful research program, great academic outputs. How do we get that to actually influence health system design and practice? And so we're really working at that nexus now in terms of informing evidence-based policy and health system design and practice.
Brilliant. Yeah, it seems like a huge undertaking, and as you said, is like very ambitious to start off with, but a lot of the good projects are ambitious. So
yes, and that that combined with your introduction of me just makes no wonder I feel so exhausted.
Absolutely. So in this regard, Tiffany, with the kind of we have seen in the last few years this emergence of these large-scale population-wide studies in different countries, US, UK. Canada's been kind of trailing behind a little bit. We're trying to catch up with, as you know, you've been involved with the HostSeq program and other programs now, hopefully being put together in Canada. But in Australia, can you talk a little bit about some of the large-scale population-wide studies that you might have are undertaking and setting up in Australia?
I certainly can. And I mean, I should qualify that, Australian Genomics partners with all these initiatives, and some of them we administer, but, a lot of them are sort of independent programs that are supported by Australian Genomics, just by the very nature of how we sort of do what we do these days. So a few programs, and I agree, I think it's been an interesting transition over the past few years in both clinical practice and genomic health research, is that move away from specific cohort studies and a clinical indication that we're throwing genomics at, to looking at more population scale activities. The first I'd mention is what we called Mackenzie's mission, a large reproductive genetic carrier screening study. This was a study that there was a young couple, Rachel and Johnny Casella, whose child, they did sort of everything they could during their pregnancy to ensure, a healthy outcome. And they realised early on that their child had SMA and tragically died at 7 months. And they were very frustrated at the whole health system design, that this information was not available to them prior to the birth of their beautiful daughter, and lobbied government about the need for changes. And as a result, this Mackenzie's mission study was born, and that involved approaching or offering expanded reproductive carrier testing to 10,000 Australian couples, and evaluating not only sort of components of the gene list, what conditions should be screened for, the ethical and legal lens, but also reproductive decisions made by couples when informed with this information, and all the downstream sort of health system impacts. So that was the first large study in Australia that was really moving away from targeted clinical diagnostic sequencing, I guess. We've got another study that's led by colleagues at Monash University in Victoria, Paula Kars and Jane Tiller and colleagues, that's looking at a DNA screen, so offering Australians information about their risk for developing things like familial hypercholesterolemia, ovarian and breast cancer, or Lynch syndrome. And an interesting element of this study is that they were hoping to recruit 10,000 individuals. They had a very good media strategy, and in the first 24 hours were oversubscribed. with members of the Australian public interested in participating and receiving this information, which I think is a very interesting reflection of public perception and people's interest in embracing this sort of knowledge.
Yeah, absolutely. Absolutely. Oh, that's fascinating. Go ahead.
Sorry, I guess the other ones that are more about less about providing information back to participants and more about enriching population databases. So Daniel MacArthur and colleagues at the Centre for Population Genomics were successful in a funding opportunity for an Australian genetic diversity database, which they're setting up currently, called Our DNA. And this will be really looking to enrich the databases with to ensure that they have a better representation of Australia's genetic diversity, including Aboriginal and Torres Strait Islander people, people from Oceania, Southeast Asia. So we've got quite a multicultural population, and Daniel and team are really working to ensure that that's better represented, in our databases.
Yeah, brilliant. You've touched on something that's very close to my heart, and we, it comes up, especially when you start talking away from disease and into the population-wide studies. This idea of diversity and inclusion keeps coming up again and again, and it's such an important aspect that we could probably have a conversation or a podcast just on that topic separately. But I think for our listeners' benefit, can you talk a little bit about the importance of capturing that diversity of the population diversity for all these kind of population-wide studies? What's the downside of not doing that, and what's the upside of actually doing that?
Yeah, I think it's certainly a very pertinent and timely issue that a lot of our nations are dealing with. And, the excellent Silent Genomes Project in Canada. I think we've got this interesting nexus at the moment where we're empowered with genomic information and genomic tools that can inform risk prediction, a real transition from health system design, from reactionary, symptoms-based sort of health system as a cost, to moving towards more of this prediction, prevention, risk evaluation, etc. But as you know, with the underrepresentation of so many ethnic groups, currently polygenic scores and those sort of risk prediction algorithms, you find if you're of Western European descent, but the efficacy of those scores in other ethnic backgrounds is of real question. Yeah. And so what is our responsibility as nations? There's always this appetite to quickly move and embrace the shiny new technology and advance. But we really need to move at a pace. Like, we can't continue to leave people behind within our own communities and in terms of international communities and other nations that are not yet benefiting from these technologies. I think we need to think in a more, a more sort of altruistic and equitable fashion about how we're even embracing these technologies. I guess too, Naveed, beyond just representation in databases, ensuring that, particularly in Australia, we've got a national Indigenous genomics network led by Alex Brown and colleagues, and they're looking at other processes of enriching the genomic ecosystem with Indigenous perspectives. So workforce and capacity development, considerations of Indigenous data sovereignty, sort of embedding within the genomic ecosystem that First Nations lens, to make sure that it's not just sort of frequency information in databases, but actually embedded across genomic implementation.
Yeah, absolutely. And I think there's so many, as you said, aspects to this. education and for providing information. That's another aspect of. In Canada, we found, especially in the HostSeek project we were doing, I know it was under kind of the COVID stress, I call it COVID stress environment, but still the education of certain underrepresented communities and the reason for them not engaging is so much work to be done in that sense that as you said, it's all our responsibility that we kind of do that and do it well. It's not just about engaging, but making sure that we do it well. I think that's an important part. So I think this is a nice segue into the next thing I wanted to talk to you about, and taking things back to the 35,000 feet, and just talking a little bit about how future genomics will impact things in the future in terms of personalized medicine, and what role do you see genomics and big data playing in the future of medicine, or specifically personalized medicine?
Well, you're sort of asking the wrong person, because I'm really embedded in this. So of course I'm going to say it's going to be everything. So
you and I both, but still.
We're preaching to the converted.
Yeah.
So we like to think and play with the idea a lot about life course genomics. So where, it's along that paradigm we were touching on earlier about really reimagining health system design, which sounds so easy, right? When I just say it like that, reimagining health system design. But if we, but imagine a scenario where, a young couple planning on having kids has expanded reproductive carrier testing, let's say on a genome backbone, then that data is retained and can inform, and then so their child might have prenatal testing or newborn screening. If that data, both the child's and parental data, is required for an acute care incident or early child health and rare disease, really utilising not only genomic interventions, but also the data derived from them throughout one's life course. Risk prediction, pharmacogenomics, then sort of targeted precision adult healthcare and therapeutics. We haven't even touched on sort of cell and gene-related therapies. A lot of our talk with politicians and bureaucrats is about how genomics is transdisciplinary. We can't look at genomics in the same way that we love sort of segmenting clinical intervention normally by sort of organ system. It really is pandisciplinary and across the life course. And it means that we, from a bureaucratic and even diplomatic way, we need to consider this technology differently, because it really does have implications for all of health system infrastructure and health technology analysis. And, we've got to sort of shift everything now that these technologies are available and becoming more democratized.
Yeah, I totally agree. I was talking to somebody in the political sphere the other day, and I was trying to explain to them that if you look at all the medicine and different disciplines and different areas of infrastructure in a kind of in different pillars, genomics kind of goes across. It's a foundation that all these pillars are built on. It's not one of the pillars, because they were talking in the sense of like, yeah, when we add this pillar, like, oh, actually no. As you were saying, I think it's a similar thing, that genomics is not a pillar that you will add next to it. This is a foundation that goes across all the pillars. So,
yeah,
and this is how it really needs to be, addressed. Otherwise, you're right that it becomes very piecemeal. Attach it here and attach it there. It's not about attaching it. It's about building a system that takes advantage of the whole available technologies. You're absolutely right.
I think it's an interesting one, Naveed, too. I mean, from that is that we need to change our language and communication with, yes, bureaucrats, but also, clinical specialties. It's not, we're not telling you to stop being a nephrologist and chuck all that knowledge out the window. It's about applying a genomic lens to your current practice. And equally, if I'm speaking to a federal agency that deals in digital health, I'm not trying to take over your job. I'm trying to bring a genomics perspective to what you currently do. And so we're actually trying to sort of lift all the boats rather than sort of overcome other people's specialties and activities.
Correct. Yeah, it's a tool that you can use. It's not replacing something. It's just giving you a clear view of things and probably an earlier insight into things that in some cases that you could use to expedite, treatment courses or a million other things. So yeah, I totally agree. So yes, that's all nice, and you and I both are very, we do this every day and get excited about it. But we also know that while this has a lot of potential, there are challenges, right? There are still challenges. So what are, in your opinion, all the challenges that we need to address in the short and medium term before we can actually see personalized medicine in reality and implemented in the healthcare system? Or more implemented in the healthcare system, because in some places you can, they're already doing some stuff.
Yeah, I think, yes. And this is the thing that keeps both you and I up at night, I'm sure. So there's some activities that I think there is widespread recognition through healthcare systems about the potential of this technology, but also the challenge of genomics. That sounds expensive. We've really got to shift beyond viewing healthcare as a cost. But equally, it is a transformative technology and will require shifts infrastructurally. So how do we, particularly, Canada and Australia, we've got provincial or jurisdictional healthcare responsibilities. We've got federal or Commonwealth healthcare responsibilities, that natural propensity to pass the buck between the two. I think we need to consider, are there privacy and legislative implications associated with access to data broadly? In Australia, there's even a question legally about who owns one's genomic data. So there's legal and privacy sort of regulation that has to shift. There's infrastructural practices that need to shift. We're going to need registries of healthcare interventions nationally that are accessible to enable data reaccess and reanalysis. So all that, just let's lump in one big bucket, that whole mess, saying infrastructural stuff. Then workforce capacity is a big one, and looking at alternate means to build capacity, be that through analytics, through well-designed participant, patient, consumer platforms, platforms for healthcare practitioners who are not genetic specialists. How do we enable uptake and safe use of genomics with on a sort of mainstreamed level? And then, of course, equity from both culturally and ethnically diverse communities, remote and regional access, until we're starting to see, a neurologist who works in a regional centre ordering a genomic test and comfortable enough to interpret it and provide support to their families. Then we're not really achieving that national mainstreaming of genomics. I think beyond that, a big barrier is that I feel like, despite efforts, international efforts like the GA4GH and G2MC, we still have a propensity to recreate the wheel. I know everyone's health system, we all have our idiosyncrasies and we're all little snowflakes, but equally there's a lot of mistakes we've made that could inform other nations that are just off the back of their sort of COVID infrastructural investment, considering embracing genomics. And I think the current discussions about potential for both collaboration between nations or like across the Commonwealth or regional, I think are really exciting, because then it's going to feed into this virtuous cycle of not only learning from each other's implementations of genomics, but that cultural enrichment, the more diverse resources in other languages, this whole sort of enrichment process across different nations, I think is a really interesting one that I'm very excited about at the moment.
Yeah, absolutely, absolutely. As you were talking, I was thinking of, and I think you've covered all the potential challenges. And I think a lot of them are, some of them are, if not a lot, then some of them at least are just the way we have to approach this and think about this, whether that's policy and, as you said, the cost. I mean, the cost savings, eventually the cost savings will be huge if you can, diagnose early and things like that. But right now, there's everybody sees the dollar signs, the cost of actually doing it. So and passing the buck is a yeah, we see here in Canada as well. One thing while you were talking, I can't help but myself but ask you, because it's fascinating, interesting to me, is this idea of this AI coming our way, right? Chat GPT and all sorts of, not just one platform, but all sorts of AI things. And when I talk to myself, there are days when I say, "Well, it's fantastic, AI is coming our way. It's going to make things a lot better and smoother and quicker." And there are days when I wake up and I'm like, "Oh my God, AI is going to complicate the genomics, personalized health, see so much more." What do you think? I just like to know, what are your thoughts on this? Again, we could talk about this for hours, but I have to.
I cracked the joke the other day. We were talking about AI-enabled algorithms for variant prioritization. I said, yeah, and then Skynet becomes self-aware. And haven't you seen Terminator? Look, I think beyond the obvious potential utility and efficiencies that could be gained from AI, particularly in the context of not only genomic data analysis, but longitudinal sort of health outcomes, phenotype, sort of correlations with genetic, variant sort of patterns. And, as you say, the chat GPT and facilitating engagement and education around genetics and genomics. I think there is huge potential with AI. I think, and I'm going to credit Alex Brown, because he always gets cross with me when I say you need to move at the pace of public trust and don't say hashtag Alex Brown. But I think that's a big thing. People are, just as you were saying, Naveed, some days you think, wow, this is all going to be easy with AI. And then the other days you're like, oh, God. I think we need to be very wary, particularly given people's inherent sense of a relationship, or there's something significant. Anna Middleton's work with Your DNA, Your Say, people have a different relationship with their genomic and data and their DNA. And so when we need to be careful, we're applying these techniques and sharing these data and, taking advantage of what they've donated to our interrogation with respect, and just, I think treading, a bit of conservatism in the adoption of AI would be my sense.
I would totally agree, and I think it's the responsibility, as you said, when people donate their DNA or their data for scientific research. There's two aspects to that. One is we have to make sure it's used, right? We can't lock it behind a key, and especially if they've consented for it to be used, and then we have policies and barriers where people can't access the data. That's really, the onus is on us to make sure that's used. But when it is used, we have to also make sure that's used in the appropriate way, regardless of whether it's anonymous and gets back to an individual or not. It's still their DNA, even if it's in a pool of a anonymized data set. It's still people's DNA, and we have a responsibility to make sure that it's used in an appropriate way. So I would totally agree with you, that I think AI is going to be fascinating, but we have to pace ourselves. We just can't throw everything at everything and then try and. This is not something where you can say, "Oops, I take that back."
Yes.
Right.
Yeah, but that's all health system interventions, right? Like,
yes,
even
exactly.
and you're sort of pursuing the line earlier about, well, around the use of genomic information with underrepresented communities, and, you know, sort of how is it the pace that we should be going at? And like, once it's in practice, it is almost impossible to unpick it. If it's publicly funded and available and clinicians are requesting it,
Yes.
even if the algorithm, even if the polygenic score is largely ineffective to 30% of their patients,
yeah.
stopping that being used and replacing it with another one is going to be so hard.
Oh, yeah. Yeah. We saw some early examples of people using, you know, the 23andMe results and making decisions which in many cases didn't make sense. And, you know,
yeah.
so absolutely. I think we and education and careful going at it carefully kind of goes hand in hand. We've talked about it before, but yeah, absolutely. Okay, well, Tiffany, I think this was absolutely fantastic. As I said right at the beginning, we could probably talk for hours, but I know you have just the start of your day and you have a million things to do. So I would really thank you from the bottom of my heart for finding time to come and talk to us. I will say that I'm not promising that we will not be. I will not be asking you for your time again. I enjoyed the conversation.
Oh, please do. I had a great time.
Do this again. Yes, absolutely. Thank you so much.
Thank you, Naveed.